It's February 1st, and we're getting closer to marking 1 year since the pandemic was declared in America.
I'm officially declaring a national emergency.
Right when we feel like we're getting a handle on the new normal, new challenges seem to present themselves. More questions pop up, more bumps in the road define success. But as everybody works together to find common ground, we're also getting closer to the light at the end of the tunnel. Vaccines are rolling out, and the process is getting stronger each day. Tonight, we're answering all of your questions about the vaccine, what we know, what we don't know, what progress is being made, and how the pandemic has changed the way for a normal doctor's visit as we work with each other for a brighter future ahead. We Together, a coronavirus discussion.
And thank you for joining us tonight for our special discussion where our goal is to answer all of your burning coronavirus questions. I'm Molly Patt. Tonight I'm joined by Dr. Soni Matthew and Dr. Susan Bryant from Stormont Vail Hospital. So thank you both for joining us tonight. And we do have a lot to get to, and our time together, it goes by fast. So first I want to get an update on the latest numbers and trends that we're seeing right this minute. So looking at the numbers in Kansas, more than 279,000 people in the state have tested positive since the pandemic started. More than 3,000 people in this state have died from the virus, and right now 550 people are in the hospital fighting the virus in Kansas. Now, as of today on the vaccine front, this state reports more than 413,000 doses have been distributed across Kansas. More than 229,000 vaccines have been administered, including both the first and second doses, which means only 55% of vaccines have been used. That accounts for more than 185,000 people that have been vaccinated, which is 6.4% of Kansans. But Dr. Lee Norman with the state health department says that those numbers are actually way off. They aren't that bad, and the reporting problems are driving him crazy. So here's what he said today about the numbers and pointed fingers at multiple reporting systems for the issue.
I talked to these executives from hospitals and the chief nurses and the infection prevention people and whatnot. And I know they're given they say we do not have one dose of vaccine. And I'll say, okay, then how come you're 1,800 doses behind? And they'll say, gosh, we thought we entered it in.
So Dr. Norman says large distribution sites like a hospital are behind in reporting by as many as 4,000 doses sometimes. He says that there is a team at the health department working on this, and the numbers could reflect more accurate numbers in a week. So I'm going to start with Dr. Soni Matthew for this segment, and then we'll check back in with Dr. Bryant in just a bit. So Dr. Matthew, last week we had the governor on the show, and she said that a big point for vaccine rollout being successful was communication. Clearly the number reporting being accurate needs communication as well. So how is communication going with the state and the hospital right now?
Well, thank you for having me, Molly. I appreciate the opportunity to be on the show. In terms of communication, Stormont Vail is in close communication with KDHE as well as the county health department, Shawnee County Health Department. We take our direction from them, and we work very closely on vaccine administration as well as distribution and the eligible groups within that.
And so moving on to a viewer question from Miles Stotts. He says, when talking about how to get vaccinated, the Shawnee County Health Department just referred me to the hospital, but my doctor is not in Shawnee County. So I think he wants to know, can people go to a different county than the county that they live in, or should people go to their doctors even if their doctor is out of where they live to get a vaccine?
That's a good question. I think this is a process that's being worked on right now. My immediate response would be to contact your local county health department and take direction from them of where to go to obtain your vaccine. I think this is really important because we want to have the guardrails of who to go to and what's appropriate. These vaccine centers are being set up, but again, we do this under the direction of our county health departments.
Yeah, all about communication here. Now, as a reminder, we are in phase 2 of the state's vaccination plan, which means only 65 years and older are up to get vaccinated, along with high contact critical workers like firefighters, police officers, and grocery store employees. Also K through 12 school staff, people who live or work in congregate settings like homeless shelters, childcare, emergency shelters, or correctional facilities. They're also in phase 2. So Dr. Matthew, with that, a lot of people still really wondering when it's their turn to get a vaccine. Cheryl Starr says, is there any information regarding when the older people or groups will be receiving phase 2 vaccinations? Then Cindy Ross asked a similar question, saying that we are 71 and 72 years old, signed up for the vaccine on January 15th online through the health department. We would simply like to know where we are on the list. So honestly, this is what more than a dozen of our viewer questions look like. Can you talk about the process that Stormont is doing right now to filter through all of these people and then get the vaccine out?
These are all very important questions, Molly. I think I can help you with a little bit of insight on Stormont Vail and our workings with the County Health Department and where we are now. As of this past Friday, we've administered over 11,000 doses of the vaccine. In terms of phase 2, as you mentioned, there are different eligible subgroups in that category. We've been directed by the Shawnee County to administer vaccine to folks who are above the age of 65. That being said, we understand that in Shawnee County there are over 30 or 35,000 individuals who meet this criteria. However, we've only been allotted around 3,000 doses. As you can imagine, there is a supply and demand issue here, and we are more than happy and have the capacity to administer the vaccine, but we can only administer what we have. That being said, we have successfully administered 3,000 doses of the vaccine, but going backwards a little bit just to talk about how we've segmented that population, we looked at our population that was above the age of 73 within our county and also within our medical record systems, and we found out there were around 13,000 folks or more that fit that criteria, and we've contacted those folks to receive the vaccine. And the vaccine is going quite quickly. Friday, our vaccine line was open for 12 hours and all doses were accounted for at that point.
That's great. And so how will people be contacted with Stormont Vail when it's their turn to get the vaccine? Should people be expecting a phone call or on the app, or what will that look like?
At this time, we're using our electronic medical record system to help aid us in this process for folks who are registered or have been seen within our health system within the past 3 years or so. We know this process is not the perfect method, but we are working in ways to be able to contact folks who are outside of our medical record system as well. This is typically done through phone calls.
And so that was going to be my next question. Do you have to be a Stormont patient to get a vaccine? Obviously, that's who you're going through right now. Will it come a time when you will be doing people who aren't Stormont Vail patients?
Well, that's the hope for a future state, Molly. We're really working hard to look at solutions to these challenging situations, and one of them is administering and contacting individuals outside of folks who are within our system.
Okay, and so on that same tune, a viewer wrote in saying that the online system with Stormont is really good for scheduling, but they can't find a way to decline the vaccine or indicate that they're getting it from somewhere else. What do you suggest for people to do that?
It's a great question. I think these are part of the things that we're working through. At this time, we're looking at folks that are wanting to receive the vaccine and eligible to receive the vaccine. I think at a future state, we would consider alternate methods where folks who have received the vaccine or decline it would be able to indicate as such within their system, their medical record system.
Yeah, just kind of having to move all the way through things that we're learning day by day. Now, another viewer question, this one from Pam Olson. She asks, if you get Pfizer as your first shot, how do you know that you will get the same for your second shot, or can they be mixed from your first shot to the second brand-wise?
All right. Well, what we understand and what we've been told by the manufacturer as well as the CDC and FDA is that these shots cannot be mixed. So that's the first thing. If you receive a Pfizer dose as your first dose, you want to receive a Pfizer dose as your second dose. It's always a good idea to go back to the same institution that you've received your first dose from, if that's possible, to receive your second dose, because they'll have the information on file. In addition, you may have received vaccine information at the time of your first dose. At Stormont Vail, we actually go an additional step and we schedule that second dose for you. So we know that you've received your first dose and we know when you're coming in for your second dose, so we can give you the appropriate Pfizer or Moderna vaccine.
Yeah, so have your calendar ready when you go get your first shot so you can write that down right away.
Right.
Okay, so along with this, the Biden administration expressed concern just today that healthcare providers could be hoarding COVID-19 vaccine doses for second shots that can be used for people's initial shots, actually. They say that shouldn't be happening. So first, what are you doing to guarantee that the second shot is ready and available for somebody, and where are they being held at?
Right. So the way we work with the Shawnee County Health Department as well as the KDHE, they will let us know when they administer doses to us. So if we receive 1,000 doses, those will be allocated for either a phase 1 or a phase 2 group, and they'll also indicate, is this for folks for their first or second vaccination? We don't have a lot of latitude on determining or hoarding, as you mentioned, doses for providers or other personnel.
And so when you get these, you get your allotments in, are they going just like straight to the refrigerator and you're like counting out and then you call the people and you're ready to go, or what does that process look like then?
Well, it is a pretty complex process, but it really is based on the doses received. and who they're allotted for from the county. We take that very seriously, and we contact those groups and let those groups are notified that their doses are ready and they're ready for their second vaccination series.
Okay. All right, we're going to take a quick break here, and we're going to check back in with Dr. Matthew in a few minutes for more vaccine and coronavirus questions. But coming up next, we're going to chat with Dr. Susan Bryan and telehealth, what it's done for us this time in this pandemic and what it means for the future. We'll be right back.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Welcome back to our coronavirus special discussion tonight. Dr. Susan Bryan is also with us tonight from Stormont Vail Health, so thank you for being here.
Thanks for having me.
We want to talk about telehealth, so it's become a big game changer, obviously, in the pandemic. How has it improved over the last 10 months?
It's definitely significantly improved. Telemedicine has been around since about the 1940s. I actually volunteered in 1995 in a telemedicine program when I was in college. But the growth we've seen in the past year has been like several decades of advances because of the need for it. So it's been pretty amazing.
Yeah, and I mean, obviously, when we started, you guys probably thought it was looking really good and improved a lot, but a lot of kinks went on through the last 10 months that had to be worked out. Can you talk about that?
Yes, there are, companies internationally that are set up that are just telehealth companies. And so it's very different than a group like Stormont Vail that has to almost create it from scratch. So myself and one other doctor had been doing telemedicine prior to COVID, but since then almost everybody is doing it. And so basically we have utilized some different platforms, but really built a lot of this basically from the ground up. So we have been able to offer so many more subspecialists and primary care opportunities. In the hospital, we're using telemedicine programs. So we've really expanded our capabilities in the past year.
Is there anything that cannot be addressed during a telehealth appointment that you still got to go in face-to-face for?
There's not much. And really what I like to say to my patients is I can assess that on telemedicine and let you know, okay, let's bring you in a couple of days, do labs, and then I can physically examine you. Really the main thing that you shouldn't do on telemedicine is anything that's an emergency. If you're having some allergic reaction, some worry of heart attack or stroke, if there's something that's very urgent, obviously you need to get to the emergency room. So there are some things, especially emergencies, that you shouldn't call in the telehealth first. But most other things we can at least initially assess and have a lot better understanding of how urgent this is to actually be seen in person.
Can you talk about specifically during the pandemic, what have been the biggest challenges that you guys have had to work through with telehealth and with patients included that they can kind of expect, if they just are starting with the telemedicine?
It's probably really the connection, losing audio or visual during the visit. That's probably the biggest thing. And then we just work around that. Like today, for example, I had a patient and we were looking video to video and we lost audio during the call. So I just picked up the phone, my phone, and I called her phone and we finished it on the phone. So there are ways to work around it, but it's difficult, especially some of our rural population, and that is one great thing is that we're able to reach a lot of our rural population in Kansas through telehealth. Especially in the winter, bad weather, but sometimes the connection isn't great. But there's a lot of ways to work around it. Basically, if you have a smartphone or a computer with Wi-Fi, you can do a telemedicine appointment.
Yeah, right when you need your signal to be really strong, it just goes out.
Sometimes.
Of course. All right, so talk about telehealth becoming the future for doctor's appointments. How has it changed that idea of going into a doctor's office? A lot of people, get really anxious before that too. How has that changed?
It really has changed. The concept that you could be at work and take a 15-minute break or 30-minute lunch break and go have a doctor's appointment in your office or break room, that happens now. You don't have to take off the entire day to travel, spend the money, get out in COVID conditions or winter conditions. I have plenty of teachers and they do it from school, healthcare workers, and they're in the hospital. It really does allow so much more ease and convenience. So the ability to connect face to face and talk and see each other, and they can show me the rash or the issue right there on the screen, that it's just so much a quicker connection rather than waiting weeks or months maybe to be seen in the clinic. And then just for your day-to-day life, it can really help people not have to take so much time off, and just the ease and convenience. And a lot of people, especially during COVID, felt like they didn't have a very good connection to the healthcare system because we weren't letting them come in physically or scared to go out. And it was such a relief to be able to see our face on the screen. They know me, they're my patient. So we already have that existing relationship, and just to feel like, okay, I'm seeing somebody's taking care of me, and we're asking, do you have everything you need? Do you have your medications? So I think it just also provided patients a lot of reassurance, especially during COVID.
Yeah, that's great to hear. There's definitely a sticking point there too. Can you talk about when it comes to paying for telehealth and insurance? Is there different coverage? Is it more expensive, less expensive, anything like that?
Certainly, that's one of the reasons that telemedicine took so long to get going. Is prior to COVID, we had very poor coverage for telemedicine. I actually went to a state of Kansas conference on this a few years ago, and that was what we were all saying. We really need to get our insurance companies to cover this. So that was one of the biggest hurdles previously, is that health insurance wasn't covering it. And then COVID happened, and currently most insurances are covering at the very same way that they would cover if you're in person. So they are currently covering it, almost all insurances, the same whether you're on a telemedicine visit or in the office.
Yeah. That's great to hear. Now, when it comes to coronavirus and telehealth, is this something that can be addressed with a virtual visit, or is it one of those that kind of falls into the category you still got to go in face to face?
No, it's certainly a lot of telemedicine visits can happen with follow-up for COVID, especially once they have the things they need. If they have a pulse ox, so they're checking their oxygen levels, et cetera. So a lot of frequent contact can be made to look at them. You can assess someone how they're breathing if they're using their accessory muscles. You can hear their voice. How much they're gasping for air. So you can certainly do a lot of follow-up for telemedicine, for COVID on telemedicine. And in fact, that's one of our strategies, is keeping people out of the hospital and at home, especially during the height of it. And so it was a good tool to use.
And my last question, if people have never used a telemedicine appointment before, what should they be prepared for? When you sign on and you see yourself pop up when you're waiting for your doctor, is there anything that people need to do before you get on the call?
Ideally, you're in a well-lit area and a quiet area, that you've checked your Wi-Fi or your cell phone signal, and that you have a good signal. You can move to a different part of the house if you're not. If you're in the house with a lot of other people, if they cannot be on the internet at the same time, that helps the connection. And then we can always do pre-call trials with the nurses or with ourselves to kind of test it even before the official visit.
Awesome. Is there anything else that I missed that you want to touch on?
The only thing I would say is that the studies indicate this is the future, that in the next decade they think that about 40% of medical visits will be conducted via telemedicine. And I don't think it should replace the standard medicine. I think being in person is always wonderful. It's just another tool that we can pull out and use, and it can be a really helpful tool at times.
Yeah, that's great. All right, Dr. Bryan, thank you so much for joining us tonight. Now, we do have one more segment coming up with Dr. Matthew again, some more questions to get answered to coming up after this.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
And we are back for our final segment in tonight's coronavirus special discussion. So Dr. Matthew is back. Double masking has been a big topic of conversation this week. I had a woman call me, Allison Richard, and she said that she's struggling with the face mask just not really fitting her face. It's too big and opens up on the sides. So she wants to know if she should be wearing two masks to make it fit better. And then when it opens on the sides, does that make it not effective anymore?
Right. This is a great question. I think it's an important question that needs to be answered. There's been a lot of discussion recently about mask usage. Is one better than two? Is two better than one? I think what really has to happen is understanding the science and data behind this. We know that most masks that are available to the general public are either medical grade disposable masks or cloth masks. We know they have varying levels of filtration ability. We know that some cloth masks can be anywhere from a few percent all the way to 30 to 40% effective, as well as the medical grade mask be somewhere upwards of 50 to 60%. The physical filtration of both masks together is better than one. And a lot of times what happens is, we talk about a medical grade mask, there's pockets that open up on either side of the chin. It doesn't have a good fit around the nose and mouth. And because of that, having a cloth mask over that helps conform that to the face a little bit better and offers a better fit, offers a better filtration efficiency as well. And I think this is a great question. So thanks.
Yeah, and that might make her not have to pull it up as much either.
That's correct.
Anymore. Okay, Johnson & Johnson's vaccine is on the horizon of rolling out here soon. So what will having another vaccine on the market do for rollout?
That's correct. And so the Johnson & Johnson vaccine is a little bit different than the current vaccines we have. The current vaccines are mRNA vaccines. The Johnson & Johnson vaccine is actually a DNA vaccine, which uses a particular adenovirus to carry it. It works differently, but what's important to remember, because of the way it's structured, its durability is a little bit better than the mRNA vaccines. The mRNA vaccines, as we know, are a little bit fragile, and that's why they have to be kept at very cold temperatures and can only be thawed and used within a short period of time afterwards. The Johnson & Johnson vaccine is being kept at refrigerated temperatures for up to 3 months. So I think this will add to our arsenal of layers of protection in terms of vaccine availability.
Yeah, and Mark Dillman wants to know, did research for vaccinations currently being administered for COVID-19 start from scratch in 2020, or was there already preliminary research done for this type of virus, which was used to pinpoint this specific virus?
Well, one thing I think we need to underline is a lot of the data and science is evolving. We know more now than we did 3 months ago, 6 months ago, 9 months ago, even a year ago. For the most part, from our understanding, the research, the lion's share of the research has been done for the coronavirus 19 after the virus was discovered, and this happened around January of 2020 of last year.
All right, and another viewer question from Cheryl Starr again. She asks, if a person has recently recovered from the original coronavirus, can they catch the other variants of the virus? And I know the other variants are very new, so you can kind of answer based off the best of your knowledge at this point.
Right. So to our knowledge, and I think it's important to explain about the variants. What we know is we have the coronavirus 19 variant that the vaccines were developed for, and through understanding other subtypes or mutations, we've discovered that there's a South African variant, there's a Brazil variant, and there's a UK variant. What the manufacturers of the vaccine have indicated to us is that there will be some level of protection against these variants. How much, we don't yet know fully. The same goes for the fact that if you've been infected with COVID-19, there is an understanding that you may have a level of immunity for up to 90 days. And the same applies to that as well. We're not certain up to what level of protection you have after you come into contact with a new variant.
Okay, and Vina Gardner-Leith wants to know, if you can't get your second shot in the 21 days for whatever reason, how does that affect your first shot? So let's say you can't make it on that exact day for your second dose.
Right. So what we've understood with the vaccine, depending on the type of vaccine you receive, whether it's Moderna or Pfizer, there is a 21-day or a 28-day interval between the first and second dose. What's important to remember is there is a minimal grace period that is minus 4 days from those time periods, so either 17 days or 24 days to receive the next vaccine. However, no maximal time interval has been set forth. Actually, the manufacturers, as well as the FDA and CDC, have come forward and said, do not repeat the series if you've missed your dose by a couple of days or weeks. Continue on with the second dose.
Oh, good information there, because I don't think we've heard that before. Now, Dr. Matthew, there's still a lot of naysayers to the vaccine. What would you tell them tonight if they're still feeling on the fence about getting it?
Well, I think it's really important to remember that we're all in this together. We've tried many things, and all these things we're trying and we're attempting to do is to prevent further spread and infection of coronavirus 19. I would definitely recommend people to continue to wear a mask, socially distance, hand hygiene, and an added layer is if you're eligible and you're able to take the vaccine, get the shot. I think is really important.
Yeah, and anything else that we missed that you want people to take away tonight?
Well, I think we need to take care of ourselves to take care of others, and as Stormont Vail has as our motto, we together. Thank you for having me.
All right, thank you so much for being here, and thank you so much for watching tonight. Be sure to keep sending us your questions as well. We will continue to work at getting you all of the answers. You can email them to coronavirus@ksnt.com. I am personally reading all of these emails and bringing them straight to the experts every Monday night. Again, thank you for joining us, and have a good night.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.